In the early morning of December 4, 2024, the CEO of UnitedHealthcare, Brian Thompson, was shot and killed by a 26-year-old named Luigi Mangione. In spite of the senselessness of the act, the killing sparked numerous reactions from social media which applauded the assailant as a hero who took necessary action against the deeply flawed system of healthcare in America. What was the root cause of this violent attack? Far from an isolated act of personal malice, the killing represents a breaking point in the deep-seated anxiety many Americans feel over the quality of their healthcare and the corrupt institutions behind it. Let's take a deeper look at the healthcare system in America to see why so many are frustrated with this system. In this video, we'll explore how healthcare companies and insurance providers profit at the expense of consumers and, most importantly, how you can safeguard your finances and access the care you need. By the end of this video, you'll have actionable strategies to navigate the system and minimize its impact on your wallet. The American healthcare system. The system of healthcare in the United States has no universal government-run healthcare option. Americans usually have health insurance coverage through their employer, but this is not always the case. Patients who require treatment submit a claim to their health insurance company for approval or reimbursement. Those who are denied can often go into hundreds of thousands or even millions of dollars in debt to get the treatment they need. Claims are often denied for very minor reasons, even when the treatment is supposedly covered by the policy and is critical for the patient's survival. While efforts have been made to reform this system, they have mostly failed due to political lobbying and campaign contributions by health insurance corporations. This problem is so bad that medical debt is one of the leading causes of homelessness in the United States. UnitedHealthcare. UnitedHealthcare insures 49 million Americans and had $281 billion in revenue in 2023. The company has been notorious as having the highest claim denial rates of any other insurance company. And, in 2021, the American Hospital Association even wrote an open letter to UnitedHealthcare due to its plans to deny payment for supposedly non-essential visits to hospital emergency rooms. To understand the financial strain of healthcare, we need to examine the business models of insurance companies, hospitals, and other stakeholders. These entities often prioritize profits over patient care. Let's break down the key ways they exploit the system. Premiums versus coverage. Every year, millions of Americans pay significant amounts in insurance premiums. In return, they expect robust coverage and peace of mind. However, many find that when it comes time to use their insurance, they face additional costs such as high deductibles, co-pays, and out-of-network charges. Essentially, you are paying for coverage that may not adequately protect you when it's most needed. The fine print problem. Insurance contracts are often riddled with exclusions and complex language designed to confuse the average consumer. Whether it's denying a specific medication as not medically necessary, or classifying a routine test as experimental, these tactics are intentional. They rely on consumers not fully understanding the nuances of their policies. Pre-authorization barriers. Another tactic is the requirement for pre-authorization before accessing certain treatments or procedures. While intended to control costs, this process can cause unnecessary delays. In urgent situations, waiting for an insurance company's approval can lead to worse health outcomes or force consumers to pay out of pocket to expedite care. These strategies are not accidents. They are deliberate efforts to minimize payouts and maximize profits. The question then becomes, what can you do to protect yourself within such a flawed system? Although avoiding every potential pitfall in the healthcare system is impossible, there are steps you can take to reduce your vulnerability. Let's look at some of the most effective strategies. Understand your insurance plan. Start by thoroughly reviewing your insurance plan. It is essential to understand the key components. The first is the deductible, which is the amount you must pay out of pocket before insurance coverage begins. The second is the out-of-pocket maximum, which caps your total annual expenses for covered services. The third is the provider network, which determines whether your preferred doctors and hospitals are covered. By understanding these details up front, you can avoid unexpected financial burdens. Challenge claim denials. Claim denials are common, and insurers often count on patients not appealing their decisions. However, appeals are frequently successful when pursued with diligence. Request a written explanation for any denial, gather supporting documentation from your healthcare provider, and submit a formal appeal. Persistence is key in these situations. Negotiate medical bills. Many people are unaware that medical bills are negotiable. If you receive a bill that seems excessively high, start by requesting an itemized statement. Look for errors or duplicate charges, and don't hesitate to contact the billing department to ask for a discount or payment plan. Many hospitals also offer financial assistance programs for patients who qualify, leverage tax-advantaged accounts. Health savings accounts, HSAs, and flexible spending accounts, FSAs, are powerful tools for managing healthcare costs. Contributions to these accounts are made pre-tax, reducing your taxable income. HSAs, in particular, allow funds to roll over year to year, making them an excellent option for long-term healthcare savings. Here's a tip that often goes overlooked. Keep meticulous records of every interaction with your insurance provider, including dates, names, and conversation details. If disputes arise, having this information can significantly strengthen your case. For those seeking alternatives to traditional health insurance, there are emerging models that may offer better value or more transparency. These options can be particularly useful for individuals with specific needs or limited budgets. Health sharing programs. Health sharing programs operate on a cooperative model, where members pool their resources to cover medical expenses. While these programs often have lower costs, they come with significant limitations, such as exclusions for pre-existing conditions or specific lifestyle requirements. Carefully review the terms before enrolling. Direct primary care. Direct primary care offers a subscription-based model for healthcare services. For a monthly fee, patients gain access to unlimited primary care without involving insurance. While this approach doesn't cover emergency or specialized care, it can be cost-effective for routine medical needs. Telehealth services. Telehealth platforms have grown in popularity for their convenience and affordability. For non-emergency issues, these services provide quick access to medical professionals, often at a fraction of the cost of in-person visits. While these alternatives offer potential savings, they are not without risks. Ensure you understand their limitations and whether they align with your overall healthcare needs. Beyond individual actions, it's important to acknowledge that systemic reform is necessary to create a more equitable and transparent healthcare system. Here are a few steps we can take as a society to drive meaningful change. Advocate for transparency. One of the most significant barriers to fair healthcare is the lack of transparent pricing. Advocating for policies that require hospitals and insurance companies to disclose costs upfront can empower consumers to make informed decisions. Support legislative efforts. Reforms such as expanding Medicare, introducing public healthcare options, or implementing stricter regulations on insurance companies could drastically improve the system. Research the positions of your local representatives and vote for candidates who prioritize healthcare reform. Educate yourself and others. Finally, awareness is critical. Share resources and information with your community to help others navigate the system effectively. When more people are informed, it becomes increasingly difficult for companies to exploit their lack of knowledge. The healthcare system may feel insurmountable, but small steps, taken collectively, can lead to meaningful change. By educating yourself, advocating for transparency, and exploring alternative solutions, you can protect your health and your finances. Now, I want to hear from you. What has been your most challenging experience with healthcare or insurance providers? Share your story in the comments. And don't forget to like, subscribe, and hit the bell for more insights on saving money and building your wealth.